Hello everyone, welcome to our channel, Canadian Nurse Expert. Today I'm breaking down Addison's disease, a crucial topic for your NCLEX-RN and REx-PN exams. So, let's dive right in. Addison's disease is a rare but serious endocrine disorder. It happens when the adrenal cortex is damaged, leading to chronic adrenal insufficiency. This means your body doesn't produce enough of the essential hormones cortisol, aldosterone, and, to a lesser degree, androgens. Most cases in high-income countries are autoimmune, but in other regions, tuberculosis is a leading cause. Other causes include infections, metastatic cancer, adrenal hemorrhage, surgical removal, and genetic disorders. Now, the adrenal cortex usually produces three types of hormones: glucocorticoids like cortisol, mineralocorticoids like aldosterone, and androgens. Cortisol is vital for regulating blood glucose, stress responses, inflammation, and immune function. Aldosterone helps maintain fluid balance and blood pressure. Androgens, while minor in males, are important for libido and body hair in females. In Addison's disease, a lack of cortisol can lead to hypoglycemia, fatigue, muscle weakness, and poor stress tolerance. Without enough aldosterone, you might experience hyponatremia, hyperkalemia, hypotension, and dehydration, all of which can be life-threatening. A unique feature of Addison's is hyperpigmentation, especially in the gums, hand creases, elbows, and scars. This happens because low cortisol levels cause the pituitary gland to release more ACTH, stimulating melanocytes due to shared precursor molecules with melanocyte-stimulating hormone. Symptoms usually develop gradually and can be quite vague at first. Common complaints include extreme fatigue, salt craving, unintentional weight loss, anorexia, nausea, vomiting, abdominal pain, depression, and dizziness, especially when standing, also known as orthostatic hypotension. Women might experience menstrual irregularities or loss of pubic hair due to low androgen levels. In stressful situations like infection, trauma, or surgery, symptoms can worsen quickly and lead to an Addisonian crisis. Addisonian crisis is a life-threatening emergency caused by a sudden drop in cortisol levels. It can be triggered by physical stress, sudden cessation of steroid therapy, or undiagnosed Addison's disease. Symptoms include severe hypotension, dehydration, vomiting, abdominal pain, confusion, tachycardia, and hypoglycemia, which can lead to shock and death if not treated urgently. Immediate treatment involves IV hydrocortisone, normal saline or D5-NS for volume resuscitation, and dextrose for hypoglycemia. Diagnosing Addison's disease typically involves several steps. The ACTH stimulation test is the gold standard. If cortisol levels don't rise after administering synthetic ACTH, it confirms primary adrenal insufficiency. Blood tests usually show low cortisol, high ACTH, low sodium, high potassium, and low fasting glucose. A CT scan might be used to identify adrenal abnormalities. Treatment is lifelong and focuses on hormone replacement. Hydrocortisone or prednisone replaces cortisol, and fludrocortisone replaces aldosterone. During stress or illness, patients need to increase their steroid dose, known as stress dosing. They should also carry an emergency hydrocortisone injection kit, wear a medical alert bracelet, and have a written emergency plan. Nursing responsibilities include frequent monitoring of vital signs, blood glucose levels, electrolyte status, and fluid balance. Educate patients on the importance of daily medication adherence, dose adjustment during stress, recognizing signs of an Addisonian crisis, and never stopping steroids abruptly. For your NCLEX, remember to recognize Addison's through signs like hypotension, fatigue, salt craving, and hyperpigmentation. Know the emergency management of a crisis, stress dosing, lifelong therapy, ACTH testing, and nursing interventions like high sodium, low potassium diets, and monitoring for dehydration. Also, be able to differentiate Addison's disease from Cushing's syndrome, which involves excess cortisol. That's it for today's quick breakdown of Addison's disease. Keep studying, stay focused, and you'll ace those exams. Thanks for watching. See you next time.